At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Low Back Pain on Wednesday, August 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome. Dr. Tom Roselle here, and welcome to Dr. Tom Roselle Live. Sunday, that's the time that we do it, 12 o'clock high in the Eastern Seaboard, Mid-Atlantic area, right here on WMAL 105.9. Glad that you're joining me. And I got a kind of a follow-up program, but we're going to get into some nitty-gritty. But that is leading into a very special evening coming up this coming Wednesday, the 10th of July, 6 p.m. at the Roselle Center for Healing. And we're going to be talking about your gut, your intestinal tract, all the things that happen from a gastritis and gastrointestinal disease and bloating and those things that cause you to be constipated or diarrhea, the pain that you get from it, and the potential of other disease processes that come about as well. I'd love to have you join me. It's just going to be little old me talking to you. So please join me. And all you have to do to make that happen, go to rosellecare.com. That's rosellecare.com or drtomroselle.com. Either way, you can get in there. If you'd like to do it the old-fashioned way, 703-698-7117 and register. Remember, we have limited seating, and we want to make sure that we're prepared for you. And I promise you, we're going to have some fun. You know me, I'm going to talk about all kinds of things, maybe go off script just a little bit and talk about some of those things that are coming up. There's an interesting bug out there called enterovirus that I may touch upon this coming Wednesday evening, and something called a new potential lookout. Something's coming down the pike called SEERS, SEERS, and we may touch upon that as well. Those of you who've been paying attention know what I'm talking about. It's going to be controversial, as it usually is, but you know me. I'm going to give you the truth about everything. But let's get into the program some and make sure that, by the way, if you want to ask me a question, you can do that, not live right now because I want to make sure you get the data, but you can simply go to drtomroselle.com and send me the note and I will respond to you. I promise you, you'll get an answer this week, but make sure that you go there, write it out, and I'll do whatever I can to make a difference. But in the meantime, the 10th, don't forget to sign up for that. Do it today, right now. If you're sitting in front of the computer, make it happen while you're still listening to me. Listen, so let's get into what are things like processed broth and bouillon cubes and fried foods and candies and lunch meats, hot dogs, cold cuts, dumplings, some self-basting poultry, crab cakes, imitation fish, seasoned rice, matzah or matzo, modified food starch, salad dressings, seasoned chips, other snacks, yogurts, ice cream, cones. They all have gluten and they're not from grain. Did you hear me? They have gluten and they're not from grain. So how's a boy to know or a girl to know what to do? Well, we're going to talk about that a little bit. But all of these things can make you go like bloated. You feel like you got this 10-pound bowling ball in front of you, maybe 30-pound bowling ball, or you're about 9 months pregnant and you don't know what to do about it and you know that you're not. Well, this whole process is understanding what organ systems are involved. And the things that make you bloat generally are the inability of your body to break things down, your reaction to the environment called that's called your microbiome in your intestinal tract, your gallbladder not working the way it's supposed to, giving enough things that you need to have, it's called bile, and your pancreatic enzymes coming from your pancreas not producing the levels that they should. We have this new marketing thing now called, exocrine pancreatic insufficiency, EPI. I love it. These guys come up with this alphabet soup for all kinds of stuff now. And we've known about it in my world for all the years I've been in practice, and that's like 47 years. But once you know how to really fix it without having to, worry about it going further down the pike and causing a problem, well, we're going to get into that on Wednesday evening. But I want to touch upon the basic concepts of this so you can help yourself, because not only that bloating occurs, but you're going to start coughing a little bit if your gut's not working the way it's supposed to. You're going to have sneezing on an ongoing basis. Your throat's going to get tight. You have these asthma-like symptoms. You can even have tingling and itching. Interesting, huh? What's that got to do with anything? Muscle spasms? How about you don't feel so good and you feel like you want to throw up all the time? Or diarrhea, or conversely, can't move your bowels at all. You get this lousy, and here's the thing that a lot of people ask and they don't know where it's coming from. How about the metallic taste in your mouth? It feels like you got metal in there that's just sucking on a bunch of keys. Could that have something to do with the environment that we're talking about? The short answer is you betcha. And we're going to dig into that quite a bit. So here's the deal. When you have that bloating and you have that distension and you have that pressure, it's probably the beginning warning signs, if you will, that says that you're going to have, if you don't have it then, you're going to have loss of mineralization. What's that cause? That's called osteopenia, osteoporosis, osteomalacia, softening of the bone. You may have degenerative conditions of the nervous system. Yep, all those ongoing degenerative, oh my God, I'm losing my mind type of thing. Yeah, brain fog at the initial stages and focusing problems. That can simply be what we're talking about right now. But that irritable bowel, that joint pain, that muscle pain, that blood pressure that just won't come down, they're all tied together, and it actually goes on. Even anemia. You go in and your blood work says you got a problem. Things aren't absorbing the way they're supposed to. So we're going to show you what this means and how they tie into so many different pieces of the puzzle. Did you know that bloating that you have and that distension, that the majority of people who show this also have autoimmune thyroid problems? That's right. They have autoimmune thyroid problems because your immune system starts in the intestinal tract. And if that bloating, that distension is over the top, I can guarantee you that you're going to have problems with that. And a lot of this is locked into what we talked about, this gliadin antibody. This gliadin antibody has to do with its reaction to different types of wheats and dairy products and so forth. And we have to make sure we understand that. So the prevalence of these things in the blood is something called transferable. So those of you who like to give your blood to somebody else, guess what happens? You're sending all that weakness that you're portraying to the other person who's receiving your blood. Yeah, you might save their life, but you may be giving them a host of other problems. There's an actually interesting article that was written. It's called The Prevalence of Antibodies Against Wheat and Milk Proteins in Blood Donors and Their Contribution to Neuroimmune Reactivities. That came out in a journal called Nutrients in 2014. And I would encourage you, look it up. It's kind of an interesting article that you're going to go, huh? I didn't know that. Really? So, when you're donating your blood, and particularly in today's world, if you've been vaxxed, guess what you're doing? You're passing that little lovely thing on to other people as well. So we have to understand that the symptoms of bloating, the symptoms of, that belching, that distension and so forth, has a lot more to do, excuse me, that than what meets the eyes. So, that is it your gallbladder? Yeah, probably. Is it your pancreas? Probably. But it also can be your gut. It also could be the IgA antibody reaction. And by the way, we're going to go right back into our friend, the adrenal glands, that fight, flight, overdrive, pathway, right? Because it's responsible for stimulating the production and maintaining its availability of the IgA reaction within your system. So let's talk just a little bit about what happens, in the system and the intestinal tract. About 1% of Americans, or 3 million people, have really endpoint, really bad celiac disease. But we're not talking about that, because a lot of your doctors say, well, that's what you've got going on. Maybe. Another 7 or 8% of the people are sensitive to things coming down, whether they're dairy proteins or they're gluten proteins. And those are the things that can produce the gastrointestinal discomfort, the bloating, the headaches, the inability to digest, the other symptoms that are going on. And just remember, these symptoms range from tingling around the mouth to even hives all over your body. Your throat swells up, you have difficulty breathing. All of that has to do with what we're talking about, leading to other things. So we're talking about insufficiency of digestive enzymes starting in the stomach. You need acid. You need acid. Let me say it the third time. You need acid in your stomach to break down food. And if you don't have the enough acid, then your food isn't broken down. And that's where the bloating, the distension starts. So then it goes into the upper portion of the small intestine, and that needs an acid bolus. What does that mean? That simply means that your stomach produced enough acid, intertwined it with your food, started the breakdown of the food, and it gets into the small intestine, and at finger points, it triggers the gallbladder, the pancreas to do their job and dump their enzymes and their bile in there so you can begin to break things up even a little bit more. So when we have these things coming in there that are not being triggered by the initial stage of digestion. By the way, initial stage of digestion actually starts in your mouth. How many of you, you eat so fast you don't even realize that you had anything to eat? Well, that's because you're inhaling, so to speak. You're swallowing without chewing enough, and it gets down there, and it hasn't triggered your stomach to produce what? Hydrochloric acid, gastrin, pepsin, to begin the process of breaking things down. So we have to understand this enzyme insufficiency is a matter of all those phases of digestive function. The symptoms that you're having, the bloating, the belching, the feeling like you're going to throw up, you can't put anything else in you, the constipation, the diarrhea, all of those things have to do with intolerances that are triggered by your body not working the way it's supposed to. Now, in the advent of the world as we see it today and their farming tendencies with high levels of glyphosate being sprayed, called Roundup, it gets rid of your good bacteria in your intestinal tract, and it actually attacks that gastrointestinal tract from your throat all the way down to your anus. So is it possible to get foods without that? Sure it is, but that's another subject. And, all major problems start with the digestive situation and whether we have enough acid or whether we have enough bile, whether we have enough pancreatic enzymes, whether we have good microbacterium, your good guys, your good bacterium, all those things. So we have to really understand what it is. You listen to a lot of these guys, these talking heads, even in our world, in the medical world, or the natural healthcare world. Forget the medical world. I'm sorry I said that. You'll have to give me absolution for that a little bit later, right? There's things called lectins. Now, if you eliminated all lectins, you wouldn't have much to eat. They're kind of protein is what a lectin is, and they bind to certain types of carbohydrates. And there are thousands of different types of lectins, and they get blamed for digestive problems and obesity and your head not working, autoimmune conditions, and so forth. And, but many of the plants contain lectins. They could be among the healthiest foods in your diet. So what's the truth? Should you eat them? Should you not eat them? That's the question, right? So lectins if you will, and now I'm not getting sidebars, try to follow me with this, is that not all lectins are beneficial for everyone, but there are lectins that are not harmful, and some of them you need to upregulate your body. So we have to understand some of them will cause allergy reactions in abundance, and they can cause rheumatoid arthritis, and they can cause irritable bowel problems. They can cause colon cancer. They can cause inflammation that causes your gallbladder and your pancreas not to work the way it's supposed to. So sometimes supporting the system for a period of time in transition with the proteolytic enzymes, the endocrine pancreatic enzymes, and changing your dietary patterns, detoxifying the system and turning the nervous system back on, suddenly, miraculously, shifts virtually everything, and your body takes on a new life of its own. You've heard the term leaky gut, right? Well, leaky gut is the biggest indicator that you may have a protein lectin problem. However, the lectin sensitivities also are things like fatigue and skin rashes and joint pain and even mental problems, reaction problems, feeling like you're going to toss your cookies, throwing up, feeling numbness, weakness, your eyes watering all the time, or tightness in your throat. So there's ways of making things easier on you. So if we cook or we soak food preparations, we can lessen the effect. But that's something that will help you soften the blow to your system while you're trying to heal it up. And we can show you how to do that. This Wednesday evening, the 10th, I promise you, I'm going to go through some really interesting stuff. And we're going to show you the warning signs, the signaling that tells you you got a problem and you better pay attention to it. And the beauty of this, and I've been in practice for a lot of years, well over 4 decades, and I know that the body has the capacity to resolve itself. So that joint pain that you have all the time, that's I don't feel good situation, that bloating, that distension, that nausea, that fatigue, those skin rashes that you can't get rid of, that all has to do with your gut. And I'm going to prove it to you. I'm going to show you what happens. We're going to show you some testing that will be quite interesting. You're going to say, wow, really? I didn't know that. This Wednesday, the 10th. So all you got to do is go to drtomroselle.com and register, or go to rosellecare.com, and it'll be at the Roselle Center for Healing, 6 p.m. this Wednesday, the 10th. Join me. I promise you we're going to have a lot of fun. We're going to point out the problems with things that you've been told that, in my opinion, are blatant lies. That's, it's like, really, people are actually telling you that kind of nuts. Well, you know me, I'll probably get all jacked up about stuff, and I'll tell you some things that you didn't know about. But we're going to talk about that thing called glyphosate, and that's Roundup, and it is devastating and deadly to every cell of your body. It can cause all kinds of issues that you don't even want to think about. But I'm going to talk a little bit about them this Wednesday evening. So we're going to talk about the disruption of the enzymes coming from your liver, i.e., and your gallbladder, that bile. We're going to talk about what happens when these things persist for long periods of time, how it affects your thyroid function, how it can produce the pain and the headaches and the feeling of you're not even being present. That's not okay, right? So we want to make sure you get that. We're going to talk about how the distension, the bloating, the I don't feel good in your intestinal tract can even lead to the beginning stages of autism or autistic syndrome, because guess what? These kids are not only getting it from the vaccines, but they're also getting it from mom and the environment, the foods that you're giving them, the exposures that they have. And how about you? All of a sudden, your whole mental state changes. Could it be an autistic-like pattern? Remember I said a couple of weeks ago, maybe last week, I don't remember, that years ago was 1 in thousands of children that were born that had autistic spectrum. Guess what? Now it's like 1 in 38, 36. How is that happening? Do you think that we don't have our fingers in that puddle? by either default or on purpose. I don't know. I'm just talking out loud. But listen, we're going to talk about that more clearly this Wednesday evening. So join me. I promise you, I'm going to talk about some things that you didn't know about. And we're going to touch again on that little thing that may be coming around the corner. They're saying maybe in 2025 is called this enterovirus. That could be the next anti and the crap that we just went through about, the last 4 years, 5 years, something like that. And we'll give you the reasons for that and where you can get the data from. And I'm just saying, I'm not a conspiracy guy. I'm just a guy that's going to show you where the information is coming from, i.e. the World Health Organization, and things that are being said and who's saying them and the like. So join me. I promise you, when I do these programs, just little old me, we'll get into some stuff that, you may have not thought about otherwise, but we're going to get into this modified food stuff and how it's affecting your body, but how it's affecting your nervous system and how it's causing structure not to work the way it's supposed to. It's going to be something that you need to know about, and it's my job to make sure that I get you that data so you can protect yourself and you can protect your family. We're going to talk about the functions of the stomach and of how it kills bacteria and the mechanical and the chemical pieces of digestion. We're going to talk about how it holds things to get ready to release into the lower portion. There's multiple pieces. I'm going to talk about why you get GERD, and that you don't need the drugs to fix it, that you can actually fix the damn thing and it'll turn it around. So if you knew you could do that once you want to and get off of these other silly things that you have yourself on now, I promise you're going to walk away with a lot of information, and you're going to know more about what's going on than your physicians do. So join me. This Wednesday, the 10th, 6 p.m. at the Roselle Center for Healing in Fairfax. Go to rosellecare.com. That's ROSELLECARE.com or drtomroselle.com and sign up, or 703-698-7117. And join me immediately after this. Go to drtomroselle.com and hit that switch and join me on Ageless Health live stream. We're going to continue the conversation. I promise you it's going to be a great show. We're going to get into some nitty-gritties and some controversy and hopefully stuff that'll save your life. Remember, I do this for one reason only, on an ongoing basis. I love you all. Have a great Sunday. See you next time.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Low Back Pain on Wednesday, August 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.